First, we are going to do the OA distraction manipulation. So for this one, you're going to want to have your patient scoot off the table so that the edge of the table is around T1, T2. Then you are going to take them in a cradle hold, rotate their head, and then I'm going to switch sides so you can see what I'm doing with my thrust hand. So cradle hold, rotate. Then you want to find their mastoid process. That's going to be your point of contact here. You start with a little distraction, and then you give a thrust. Next is the AA contract relax technique. So for him, we're going to say he's limited on the right side. So when I bring him up into the flexion rotation test, he's limited on the right. What you're going to do is while you're holding the patient here, you're going to have them take their eyes, look to the left, and gently rotate your head to the left. Hold it, hold it, hold it. And then relax, and then try to work into that restricted range of motion. Okay, next is the supine OA pump mobilization, and we are going to try to isolate his left side. So I'm going to go ahead and start him at about 20 to 30 degrees of left rotation. And then as I'm mobilizing, I'm thinking about taking the right portion of his chin down in this diagonal direction towards his left side OA joint. You're going to give a little scoop so he's in some OA flexion and a little bit of traction. And this is where you bring your shoulder in and give that downward force. Then if you want to block C2 to make it more specific, all you have to do is find the C2 spinous process. This is going to be your contact point here on the hand. Give that bony block, same scoop and traction, but this time we've got a little wedge on C2, and we're mobilizing down. Next, we're going to get into the upglide and downglide techniques. Obviously, my table is a little bit low for this. I would ideally like to be in a standing position so that I could use my body a little bit more. But for the upglide technique, it's going to be just like performing an upglide mobilization, but just in a little bit more of a locked out position, but you are going for that like upward rotation type of force. So your like manip hand will be rotating this way and your supporting hand will be rotating down. So you're getting this kind of twisting motion. So you're going, this is for mid-cervical, so we're gonna find the level that we're interested in. Spinous process goes point of finger, and then the edge of your finger will go across that articular pillar. You are going to side bend, don't help me. You're going to side bend towards, side glide towards, and your rotation will be up this way. You might have to play with the level of rotation, and once you find a spot that you think will go, give your thrust. The downglide setup is fairly similar. You're still going to get the same side bending, side glide, and rotating away. But this time you're going to pre-position them into a little bit of extension, and rather than getting that roll, we're giving more of a thrust this way. So for the down glide, we're gonna go here. Same points of contact. We're going to get that side bend, side glide,